managing actual confirmed cases and taking clear steps to protect their citizens. This government is determined to do all we can to prevent harm to our local population. We do not have a confirmed case in Bermuda, but we must and we are preparing for a worst-case scenario and take steps to reduce the potential for any unknown community spread. Following a cabinet meeting this afternoon, and based on recommendations from the Minister of Health and the Minister of National Security, and to ensure public safety, I can confirm that all government public events will be canceled for the next 4 weeks. Additionally, we are urging event organizers and sporting bodies with anticipated gatherings of more than 50 people to postpone their events. We are at the beginning of the weekend when Bermudians of all walks of life attend churches and engage in faith-based activities. We are strongly recommending that churches encourage and adopt appropriate social distancing as part of their services and events. Recognizing that this virus has a greater impact on seniors and those with pre-existing health conditions or compromised immune systems, such persons must consider that it is best for them not to attend large public events and gatherings. With the Minister of National Security, our aim is to meet with church leaders early next week to discuss how we can together implement a safe approach to ensure the continued spiritual attention to their congregation. Again, I would like to repeat that all government events for the next 4 weeks have been canceled, and we are of course urging organizers and sporting bodies with anticipated gatherings of more than 50 persons to postpone their events. These decisions, and we have looked at the actual ramifications. However, the health and well-being of Bermudians is the most important consideration. We are imploring all Bermudians to be extra cautious as they move about the island this weekend and over the next few weeks. If you are sick, please stay at home. Do not visit others and ask others not to visit you. To business owners, please continue to put in place the highest health and safety standards for your workers and your customers. Any further decisions regarding government offices and government schools will be made over the next few days. However, consideration is being given to bringing the Easter break forward by a few weeks. The Minister of Education was in the House of Assembly during the cabinet meeting, and there will be further consultations with him following this press conference. During yesterday's press conference, I mentioned the term social distancing, and it is important as we must curb our natural affinity to shake hands, hug, kiss on greeting each other in our workplaces, in our churches, and in places of entertainment. Now, I know that a number of persons would like to know and understand precisely what is taking place on our borders. Effective yesterday, the Minister of Health issued a travel ban, and this prevents the entry into the country of individuals who have been in Italy, China, South Korea in the past 14 days. Additionally, and Iran. Additionally, anyone, as announced in the House of Assembly before, who has been in either France, Germany, or Spain will be on the level 2 list of countries. And that will mean that they will be requiring a mandatory 14-day quarantine, and a travel notice and a warning will be issued. The United States and the United Kingdom remain on level 3 at this time, which requires active self-monitoring for 14 days. However, this may change on the basis of international advice, and discussions will be held with UK government and the US Council General. And one of the reasons that I was late for this meeting is I was on the phone with His Excellency, the Governor. There are many questions regarding on-island testing. Test kits and testing equipment has been ordered, and the government will arrange a private aircraft to collect that equipment so that we do not have to wait for shipping to happen. However, given the global shortage of testing kits, we will not be able to have wild-scale testing for a few weeks, which is why it is essential to maintain our social distancing and our hygiene. The government has increased cleaning inside of government offices. There is increased cleaning when it comes to public transportation, and the city and public health agencies are working to ensure that in this country, we flatten the curve. As I've said previously, it is important that we do all we can to ward against community transition in the event that we may have COVID-19 on our shores. I've said it many times, and I must say it again. Thoroughly wash your hands frequently using soap and water. And if you're unable to use soap and water, use hand sanitizers. If you cough, please do so into your elbow or a tissue. Disinfect surfaces frequently and avoid close contact with anyone displaying cough and fever symptoms. If you have a cough or a fever, please stay home. Do not go to the doctor's office. Do not go to the hospital, and call your doctor. If you do not have a doctor, please call the hospital. What is all most important at this time is that we remain calm. There are many countries that have successfully battled this virus, and it is Bermuda's desire to be one of those particular countries. That is the reason why we have taken these actions to date, and we are continuously meeting throughout the weekend to make sure that if there's any actions that are required due to the rapidly changing international situation, that those changes will be communicated to the public. At that point in time, I'm happy to take any questions that they have for me and or any of my ministers.
Until we have the test kits on island, the test will still be going to Trinidad, is that correct?
At this point in time, that is correct. However, the Ministry of Health is looking at closer testing locations, which may be able to get us sooner. But I think it is very important for me to reiterate that testing items were ordered, and the minute that those testing items are available, the government will arrange for private aircraft to collect those items and bring them on island so we can be up and running as quickly as possible.
Okay. I was going to ask, how long has Trinidad been a testing center for Bermuda?
Trinidad, it's the Caribbean Public Health Authority. So they represent, it's located in Trinidad, but they represent the Caribbean region in Bermuda insofar as public health issues. So they are the testing facility for all of the Caribbean.
I see. My curiosity was why a place that is multiple flags away from here rather than the USA or the UK, which is a single flag.
It's a regional body, and Bermuda is part of the Pan American Health Organization, and CARFA does the testing for the Pan American Health Organization.
Any other questions?
Yes, sir. Evening. Obviously, and you spoke this yesterday, we want to avoid the services like the hospital being overwhelmed. In the event that there were more cases in the hospital we're able to handle, could you walk us through a bit of what our alternative would be if there are field hospitals that maybe?
Here's what I'm going to say, Jonathan. I'm not going to engage in hypothetical situations right now where the government is focused, is flattening the curve to ensure that our public health systems are overwhelmed. And that is why it is incredibly important, especially for those persons who are at risk, persons with pre-existing conditions, etc., to stay home. Make sure that you only go out in public in case there's emergency situations. When we are able to have our on-island testing capacity at a higher level, then there will be a time where we can and mimic the other countries and the steps which they've taken, such as in places like Singapore and Hong Kong and Taiwan, where even though they are very close to China, they have been very successful. We have had strict public monitoring. There was a bipartisan briefing earlier today where members of both sides of the House of Assembly and members of the Senate were fully briefed on where we are. We are continuing to put out information on a daily basis. The hospital has, as I indicated in the House of Assembly earlier today, ordered more equipment, ordered more ventilators. But what is most important is that persons who are most at risk of catching or making sure that they are seriously affected by this virus, maintain social distancing, stay at home, and only leave if you have to.
One last question. It was just something that was raised. I would ask it. Someone asked us whether insurance would cover testing when we had it.
I can assure you that when testing comes to these shores, it'll be covered by the insurance agency, the government of Bermuda. We are not going to spare any expense and require anyone to pay. This is a circumstance where it must be understood that the Minister of Finance has made it perfectly clear that there is no amount of money that is going to replace the issues when it comes to public lives. This is important. The fact is that we all have families, and we do not want our senior loved ones or those persons that may have diabetes and or asthma and other things to become infected and develop serious conditions. We do not have any confirmed cases at this time. As I indicated in the House Assembly, there were additional tests which came back negative. We are now implementing additional travel restrictions at the border, requiring mandatory quarantine, and we're reviewing the issues with the United States and the United Kingdom in discussions with our partners to see if there's anything further which may be required. But it is important that we act based on science. It is our job as the cabinet of this country to make sure that we lead, and we lead effectively. We know that, and we just finished an emergency 3-hour cabinet meeting. There are lots of persons that want us to do lots of different things. We can avoid the example of Italy. We are taking the steps to make sure that our public health systems are overwhelmed. And if there is a case of confirmed transition here on island, there'll be additional steps that are taken.
Thank you. I did have a couple more. I just want to check.
Couple more?
Are all these tests from the airports, the tests that have gone so far, are they all from the airport screening? Are they all come from travelers or the screening at the airport, or do we have some coming from
Both. There's both. Some persons have presented with a travel history, relevant travel history, as well as respiratory challenges, and then the doctors have ordered the screening.
And is it an easy process for the doctors to get tests sent to?
Well, once the doctor orders the test, and some of them have actually been done by the clinic, so it just depends on whether the doctor has actually ordered the test and completed the test. I know one doctor in particular that actually conducted the test himself, and then some of them are referring their patients to the clinic for the testing, and then, like I said, then the testing is sent overseas to CARFA for analysis.
Excellent.
The one thing I did want to return to my first question, just from a practical point of view, when it comes to medical emergencies as such, we have our relationship with the Caribbean, but we are closer in proximity to the US.
Mm-hmm.
In these circumstances, would it not be better to have a relationship, a medical relationship with the US?
We have medical relationships in every particular issue, but I think, as you can see, the United States is having a particular problem with their testing capacity itself. As I explained inside of our remarks, since yesterday, the Ministry of Health is examining additional options, whether that be Canada, whether that be the United States, or other closer reference labs to get quicker things. But let me be clear, and I've said this, and I want this to be perfectly well and understood. We want to get on-island testing capability up here as quickly as possible. The equipment to make sure we can do that has been ordered. The minute that equipment is able to be picked up and collected, the government of Bermuda will make sure that a private plane collects that equipment and brings it back so we can be up and running as quickly as possible. Thank you.
Thank you.
Thank you, everyone.